Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence. Morning, folks. Welcome to the PT on Ice Daily Show, brought to you by the Institute of Clinical Excellence. My name is Dustin Jones, one of the older adult faculty, and today we're talking about heart attacks, myocardial infarctions, what to do, but more importantly, what not to do in this scenario. I want to share a recent experience that I've had of being kind of exposed to the care, the intervention, but then also the care after myocardial infarction from someone that I love dearly, and just being able to witness this process, having worked in this process as well, but to see it from more of the family side has been really eye-opening for me. And I think there's a lot that we can do as rehab and fitness professionals to really walk alongside people and help them navigate this very, very challenging time. So this time of year historically has resulted in an increased risk of myocardial infarctions, particularly for males, right? As most older adults, physical activity goes down during the winter months, and then we may have this sporadic, higher intensity activity that life asks of us, like shoveling snow, for example. And so we can see an increased risk of heart attacks, especially with something like shoveling snow. And shoveling snow is not the problem. It's just a relatively higher intensity activity that kind of comes out of nowhere when someone's been relatively sedentary or physically inactive. There's been some interesting research to look at what are some of the elevated risk profiles during this time of year, especially with doing something like shoveling snow. And men in particular, they have a 16% increased risk of having a heart attack when they are shoveling snow and getting admitted to a hospital. It needs to be a quote unquote heavy snow, around 7 to 8 inches. They also have a 34% increased risk of passing away from that heart attack as well. And so it's on a lot of people's minds. You probably are working with some folks that may have had some type of health scare recently. And I just want to talk about what we can do, but also what we should not do in this scenario. So like I mentioned before, I've had a loved one that had a heart attack a week or two ago when we had a relatively heavy snow here in central Kentucky, West Virginia. They got the typical treatment, which for most individuals, they're rushed to the hospital. They are, assessed, and usually there's some type of stent placed if there is some type of blockage within one or multiple coronary arteries. With my family member, it was the right coronary artery, and they put 2 stents in. They're monitored, and they're usually put on 4 different types of medications. There's usually an anticoagulant, usually a blood thinner, some type of statin, and then a beta blocker. Some medication's going to influence blood pressure if they're not on that already, right? And so my loved one wasn't taking any medications whatsoever, and so they were given those 4 kind of classifications of medications. They were in the hospital for a couple days, and then they were discharged home. And I was home helping this loved one, and it was really eye-opening for me to see the discharge papers. As a home health clinician, I've read tons of discharge papers, right? I understand how difficult it is to follow some of these instructions, to translate some of the medical jargon. You're sifting through 20, 30 pieces of paper after you've been very overwhelmed with probably a lot of new diagnoses, a lot of new medications. It's a lot to manage. And I'm reading through the discharge instructions, and it was giving advice on nutrition, right? Which was pretty solid advice. It was, telling them, here's the medications that you're going to be on now. It was also giving some physical activity recommendations too, to the line of as tolerated. Also mentioned the danger of strenuous activity and how you may not want to do very strenuous things because that's what caused your heart attack, right? And this is where I feel like the ball has been dropped in the course of care of my loved one, but I know this is happening to so many folks, is that they have this very, near-death experience, right, if they're lucky. And there's a large kind of predominant message of safety afterwards. Let's play it safe. You need to take it easy, all right? You don't need to be doing that really hard, strenuous stuff like the shoveling snow that you were doing when you had the heart attack. And there is some truth to that, right? Like we need to be realistic and consider that activity and the demands that it placed on your cardiovascular system almost caused you to die, right? Like we cannot deny that. But this message of safety and taking it easy is also allowing the conditions that created this problem. It is opening up the door to continue deconditioning that even allowed the shoveling of snow to be a very strenuous activity. See, in a lot of these scenarios, the shoveling of the snow or whatever that strenuous incident is, it's the straw that broke the camel's back, right? It was the demand on that cardiovascular system that cardiovascular system could not necessarily handle, and the result is a myocardial infarction. But what if instead of taking the straw off the camel's back, what if we got the camel stronger? What if we got the camel fitter? What if we're able to build the camel's capacity so whatever that activity is, it's a relatively low activity. It does not ask a lot of them, right? If you've taken any of the modern management of the older adult courses, you're probably thinking of a very important concept that we talk a lot about throughout our curriculum. And that's that concept of 1 rep max living. 1 rep max living is when the demands of life are near or exceeding my capacity as a human being. So if I'm very weak, in my lower extremities, for example, and I can barely do a sit to stand transfer, I may be giving 99% of my effort or my 1 rep max to perform a transfer like sit to stand. Well, that's a big issue, right? Think of all that life is going to ask of us, that I'm giving a lot of effort to do a seemingly simple task. I need to build that capacity so we lower the relative demand of that transfer. And this is no different. We need to build the capacity so when life asks that individual to shovel the driveway to clear the snow so they can leave their home, it's going to be a relatively low demand and not cause something like a myocardial infarction. I do want to acknowledge, right, that like heart attacks are not necessarily an exercise problem, right? Like there were some maybe lifestyle behaviors, there's some genetic components that could lead to some blockage in those coronary arteries that is going to influence someone's exercise capacity, right? Like I don't want to come across and disregard some of those variables that we know influence the risk factors of having a myocardial infarction. But we don't want to ignore the power of building capacity in this scenario and what that can do for that person's life. Let's stop taking the straw off the camel's back and let's make the camel stronger. Safety is a goal, but is not the only goal. We want to build capacity in a safe manner. So what does this mean for us when we're working with these individuals? And I think this is a huge opportunity because it's been eye-opening for me to walk alongside my loved one as they're navigating this process after they've had the MI. The first thing I think we need to do is we challenge that individual, right? We are going to track vital signs. We're going to measure them, but then we're also going to track them. We're going to track symptoms. As we execute some of these evidence-based, higher intensity, interval-based training that we know is helpful for individuals, especially through the course of cardiac rehab, for example. We're going to incorporate large muscle groups. We can use some of these amazing ergometers like the bike, like the rower, even a new step, right? To be very objective with dialing in our intensity, our duration while we're managing their vital signs and being able to ensure that we're in a safe but relatively high intensity situation that is going to drive change, right? We have a lot of solid evidence to show how we can build capacity in a safe manner, even in the presence of someone that's had an MI. This is what we spend a lot of time in our MMA Level 2 course discussing and programming. But I want to talk about another variable that has become more apparent to me in this scenario, and that's the psychological considerations after something like an MI. See, my loved one was one that wasn't scared of much, right? Would go out and do whatever was asked of him, shoveling snow, not a big deal, right? I'm gonna get her done. That's the kind of person that this individual is. But man, when you rub shoulders with death after doing an activity that used to be relatively simple, I want you to consider the fear that could instill in someone. When I go to shovel that snow and I almost pass away, I almost lose my life, how afraid do you think you'd be to go back and kind of push your physical limits? It messed with you a little bit. And to be honest, I had to go finish that job. I had to go and shovel the rest of that driveway after my loved one had a heart attack. And I'm an individual that is exercising at least 30 to 45 minutes, 6 days a week. I'm doing higher intensity workouts like many of you all. I'm pushing a high heart rate on a daily basis. But I'll be damned if I wasn't scared to pick up that shovel and shovel that driveway, knowing that this activity nearly killed someone very near and dear to my heart. I had a little bit of fear creep in of what if this was a relative high demand activity. Even though I know I just hit a pretty gnarly 20-minute AMRAP that morning, but I had a little bit of fear of shoveling that driveway. And man, that hit hard for me. I'm someone that does have a relatively high capacity. I'm pushing my limits somewhat on a daily basis. And just think of what this does to someone that's not doing that, that's not familiar with their heart literally bumping out of their chest and pushing themselves on a daily basis. Someone that's not doing high intensity exercise on a regular basis. Think about how scared they are. They're not familiar with that territory of those higher intensities, of what their limits truly are. And that really spoke to me. So when working with these individuals, because I've really dialed in on the vitals, on being objective with ergometers and doing a lot of high intensity interval training and just a very gradual logical progression of those intensities and durations and the relative demand of that activity. But one thing that I don't think I truly grasped was the psychological impact of almost passing away, doing something relatively strenuous. So I think we need to really consider that. We need to consider the fear when pushing higher intensities. I may not trust what my body's capable of doing, or I may have an inaccurate perception. And so as we're pushing into these higher intensities, we need to be very thoughtful of that fear. And so what this could look like is a very gradual progression, not big jumps, but small jumps, whether it's an intensity variable, like if we're using wattage or a certain pace on an ergometer, or duration, right? We take small jumps that we're kind of edging people into the unknown of really seeing what their limits truly are, and not just kind of blowing through that and asking them to go 110% when they've been going 50%, for example. We got to show people that it is safe to get into these more uncomfortable ranges. And it's a slow progression, right? It's almost like we're flirting with this uncharted territory. And over time, as they're consistently flirting with their limits, they discover what their limits truly are, and their limits continue to expand. And they get fitter and fitter and fitter and more efficient with their exercise, and going to ask less of their heart to pump so much blood, for example, with a myocardial infarction. So I want us to consider that, right? The big thing of what not to do, right? We don't want to play it safe right now. We don't want to take it easy. This is not the time to take it easy. We've stabilized the situation. Now's the time to build capacity. We can do that in a safe manner, but we don't want to instill fear in physical activity and higher intensity activities. And it's our job to guide them in that process. We can use a lot of these evidence-based protocols. We'll cover that in level 2, the higher intensity interval training, tracking vitals, tracking symptoms, gradual progressions. But we need to be very considerate of the fear involved, that we're pushing very, very fearful territory. And so we want to gradually expose people to these upper limits that they are scared of, to where they become familiar and know, I can handle that. I can do that safely. And then the next winter comes around, and shoveling that driveway is going to be a lower relative demand. And in that scenario, we've done that person a huge service. All right. Appreciate y'all hearing me out. I want to hear your thoughts. Are you treating anyone with a heart attack or myocardial infarction within the past few weeks? What's been your experience? I'm really curious to hear if you've seen some of that fear of higher intensity activities and physical activity that I've witnessed, and I've felt that. That's what's crazy to me about this scenario. So I'd love to hear that. Drop it in Instagram in the comments. YouTubers, podcasters, thank you for watching or listening. Y'all have a lovely rest of your Wednesday, and I'll talk to you soon. Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.